Illinois Real Estate Broker Exam Prep. Question 1. Which task is within the CNA scope of practice? Option A. Administer insulin injections. Option B. Measure and record vital signs. Option C. Administer 4 medications. Option D. Insert urinary catheters. The correct answer is option A. They help buyers evaluate known or potential environmental risks before becoming bound to the transaction. CNAs are trained to measure and record vital signs, temperature, pulse, respirations, blood pressure, administering medications, A, C, inserting catheters, D, and performing sterile procedures are outside the CNA's scope of practice. Question 2. When feeding a resident, the CNA should: Option A. Leave them alone if they refuse. Option B. Ensure upright position and safety. Option C. Feed as fast as possible. Option D. Give liquids first only.
The correct answer is option C. Inspect tubing for kinks, leaks, and secure connections.
The resident should be in an upright position, Fowler's position, 60-90 degrees, during feeding to prevent choking and aspiration. Offer small bites, allow time to chew and swallow, and ensure the resident is alert before feeding. Do not rush. Question 3. What is a contracture? Option A. Temporary muscle spasm. Option B. Permanent and painful stiffening of a joint and muscle. Option C. Type of fracture. Option D. Skin breakdown. The correct answer is option B. Permanent and painful stiffening of a joint and muscle. A contracture is the permanent and painful stiffening of a joint and muscle, often caused by lack of movement. It can be prevented by performing range of motion exercises, repositioning residents, and maintaining proper positioning.
Stressed about your non-medical assistant exam? We can take non-medical assistant exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done.
Question 4. When assisting a resident with a cane for ambulation, the CNA should: Option A. Stand on the resident's weaker side. Option B. Stand on the resident's stronger side. Option C. Walk behind the resident. Option D. Walk far ahead of the resident.
The correct answer is option C. It is approximately 70 kilograms.
The CNA should stand on the resident's weaker side to provide support and stability. The resident should hold the cane on the stronger side. The cane is used to support the weaker leg. The stronger leg moves forward first. Question 5. A resident is crying and expresses feeling lonely. What is the best response by the CNA? Option A. Stop crying, you'll be fine. Option B. I'm here to listen. Would you like to talk? Option C. You shouldn't feel lonely with all of us here. Option D. I'll get the nurse to give you something for that. The correct answer is option B. I'm here to listen. Would you like to talk? Acknowledging the resident's feelings and offering presence is therapeutic. The CNA should sit with the resident, listen, and provide comfort. Dismissing feelings, A, C, or deferring to medication, D, does not address the resident's emotional need. Question 6. What is the correct way to take an apical pulse? Option A. At the wrist. Option B. To the left of the sternum at the 5th intercostal space at the midclavicular line. Option C. At the neck. Option D. At the brachial artery. The correct answer is option B. To the left of the sternum at the 5th intercostal space at the midclavicular line. The apical pulse is taken at the apex of the heart, located at the 5th intercostal space, left midclavicular line. A stethoscope is used to auscultate the heart sounds. The apical pulse is counted for 1 full minute. Question 7. A resident with Alzheimer's disease shows violent behavior. The nursing assistant should: Option A. Restrain the resident. Option B. Remove triggers and redirect. Option C. Ignore the behavior. Option D. Punish the resident.
The correct answer is option B. It prevents the arm from crossing over the sterile contents.
For residents with Alzheimer's disease who show violent behavior, the CNA should identify and remove triggers, example noise, pain, hunger, fatigue, and redirect the resident to a calm activity. Restraints should only be used as a last resort with a physician's order. Supervision and redirection ensure safety without harm. Question 8. What is the primary role of a certified nursing assistant, CNA? Option A. Prescribe medications. Option B. Perform surgeries. Option C. Provide basic patient care under supervision. Option D. Diagnose illnesses. The correct answer is option C. Provide basic patient care under supervision. The primary role of a CNA is to provide basic patient care under the supervision of licensed nurses. This includes assisting with activities of daily living, ADLS, such as bathing, dressing, feeding, toileting, ambulation, and taking vital signs. CNAs do not prescribe, diagnose, or perform surgeries.
Are you looking for non-medical assistant exam actual questions? Visit our website pokerexams.com to access non-medical assistant exam study guide with actual questions and answers. Scan the QR code or click the link in the description to get non-medical assistant exam answer key today.
Question 9. A resident keeps asking, "What day is it?" every 5 minutes. What should the CNA do? Option A. Say, "I already told you." Option B. Ignore the question. Option C. Calmly answer the question again. Option D. Tell them it doesn't matter.
The correct answer is option B. Leave only a neutral callback request with the office name and number.
For residents with dementia or confusion, repeating information is therapeutic. Patience and calm repetition reduce anxiety, even if the resident cannot retain the information. Responses A, B, and D are dismissive and may increase the resident's agitation. Question 10. The certified nursing assistant, CNA, understands that volunteering in the community, joining a senior citizen group, and exploring new hobbies can help make the elderly person's life more fulfilling. These activities can give the resident Option A, sense of purpose. Option B, reason to complain. Option C, distraction from pain. Option D, way to avoid family.
The correct answer is option C. Activate emergency care and protect the area with a clean dry covering.
Meaningful activities and social engagement give elderly residents a sense of purpose and fulfillment. Encouraging residents to participate in activities they enjoy promotes mental health and quality of life. Question 11. A resident has tuberculosis, TB. What type of mask should the CNA wear? Option A, surgical mask. Option B, N95 respirator. Option C, no mask needed. Option D, cloth mask.
The correct answer is option D. Standardize the successful process and continue monitoring.
TB requires airborne precautions, including an N95 or higher -level respirator, fit-tested. A surgical mask does not provide adequate filtration for TB. The N95 respirator must be fit-tested to the individual to ensure proper seal. Question 12. What is a task that is outside the scope of practice for a CNA? Option A, bathing a resident. Option B, inserting tubes into a resident's body. Option C, feeding a resident. Option D, transferring a resident with a gait belt.
The correct answer is option A. Verify identity and disclose only the minimum necessary billing information.
Inserting tubes, example, catheters, ing tubes, is outside the CNA's scope of practice. Bathing, feeding, and transferring with a gait belt are all within the CNA's scope of practice. Question 13. A resident refuses to allow the CNA to take their blood pressure. The CNA should? Option A. Take the blood pressure while the resident sleeps. Option B. Respect the refusal and report it to the nurse. Option C. Restrain the resident and take the blood pressure. Option D. Threaten to withhold lunch. The correct answer is option B. Respect the refusal and report it to the nurse. Residents have the legal right to refuse treatment. The CNA must respect the refusal, document it, and report it to the supervising nurse. The nurse will assess the resident and try again later. Residents also have the right to refuse to have their vital signs taken. Question 14. What is the correct way to dispose of a used needle? Option A. Recap the needle and throw in trash. Option B. Place in a sharps container without recapping. Option C, break the needle and throw away. Option D, leave it on the bedside table. The correct answer is option B, place in a sharps container without recapping. Never recap needles, this increases needle stick risk. Dispose immediately in a puncture-resistant sharps container. Needles are never placed in regular trash. If you find yourself stuck by a needle, report it immediately to the nurse and follow facility protocol.
Question 15. A recipe uses 3.07 cups of oats per batch. How many cups are needed for 3 batches? Option A 9.21, option B 6.07, option C 12.28, option D 0.921.
The correct answer is option C, $11,550.
Multiply the amount per batch by the number of batches. 3.07 times 3 equals 9.21. Choice B gives 6.07, which adds the number of batches to the amount per batch, and choice C gives 12.28, which uses one extra batch. Choice D gives 0.921, which moves the decimal point one place too far left. Question 16. Which number is 15% of 2,800? Option A 2,815, option B 420, option C 2,785, option D 15.
The correct answer is option D, registration, supervision, and public-facing brokerage compliance for virtual or branch operations.
Convert 15% to 15/100 and multiply by 2,800, giving 420. Choice A gives 2,815, which adds the percent number to the original amount, and choice C gives 2,785, which subtracts the percent number as if it were a whole minus number amount. Choice D gives 15, which uses the percent value itself rather than taking that percent of the amount. Question 17. During a review sale, a calculator priced at $68 is discounted by 10%. What is the sale price? Option A $6.80, option B $74.80, option C $61.20, option D $58.
The correct answer is option A, RESPA restrictions on kickbacks and unearned fees.
First find the discount. 10% of $68 equals $6.80, then subtract it to get $61.20. Choice A gives $6.80, which finds only the discount amount, not the final sale price, and choice B gives $74.80, which adds the discount instead of subtracting it. Choice D gives $58, which subtracts the percent number as dollars rather than as a percent of the price. Question 18. After a tutoring center increases its weekly practice minus question goal from 170 by 20%, how many questions are in the new goal? Option A 190, option B 136, option C 34, option D 204.
The correct answer is option B, disciplinary action for unprofessional or dishonest conduct.
Find 20% of 170 to get 34. Then add the increase to the original goal for 204. Choice A gives 190, which adds the percent number directly to the original count, and choice B gives 136, which decreases the amount by the percent instead of increasing it. Choice C gives 34, which reports only the amount of increase rather than the new total.
Stressed about your non-medical assistant exam? We can take non-medical assistant exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done.
Question 19. A classroom mix uses 4 blue tiles for every 7 yellow tiles. If 28 blue tiles are used, how many yellow tiles are needed? Option A 49, option B 11, option C 35, option D 45.
The correct answer is option C. It gives the party a contractual condition that must be satisfied or waived under the agreement.
The blue tiles were multiplied by 7, so the yellow tiles must also be multiplied by 7. 7 times 7 equals 49. Choice B gives 11, which adds the original ratio parts instead of scaling the ratio, and choice C gives 35, which adds one yellow part to the scaled blue amount. Choice D gives 45, which uses an incomplete scale factor and does not preserve the ratio. Question 20. Which unit rate describes a printer that makes 132 pages in 6 minutes? Option A 138, Option B 22, Option C 126, Option D 6.
The correct answer is option D. 40 questions with 90 minutes allowed and a 75% passing score.
Divide pages by minutes to find pages per minute. 132 divided by 6 equals 22. Choice A gives 138, which adds time to the total page count instead of dividing, and choice C gives 126, which subtracts the minutes from the total page count. Choice D gives 6, which uses the number of minutes as the rate. Question 21. Between the decimal choices, which value is equivalent to 3/8? Option A 0.33, Option B 0.27, Option C 0.38, Option D 0.11.
The correct answer is option A. A legal description is intended to identify the parcel with greater legal precision than a mailing address.
Convert the fraction by dividing numerator by denominator. 3 divided by 8 equals 0.38. Choice A gives 0.33, which uses a denominator that is 1 too large, and choice B gives 0.27, which reverses the division relationship between numerator and denominator. Choice D gives 0.11, which treats the numerator and denominator as digits in a percent minus-like number. Question 22. Which list orders 4/5, 45%, 0.33, 0.41 from least to greatest? Option A 4/5, 45%, 0.41, 0.33. Option B 0.33, 45%, 0.41, 4/5. Option C 0.41, 0.33, 45%, 4/5. Option D 0.33, 0.41, 45%, 4/5. The correct answer is option D, 0.33, 0.41, 45%, 4/5. Convert each value to a decimal and compare. 0.33 equals 0.33, 0.41 equals 0.41, 45% equals 0.45, 4/5 equals 0.80, so the least minus to minus greatest order is 0.33, 0.41, 45%, 4/5. Choice A gives 4/5, 45%, 0.41, 0.33, which orders the values from greatest to least, and choice B gives 0.33, 45%, 0.41, 4/5, which switches two middle values after conversion to decimals. Choice C gives 0.41, 0.33, 45%, 4/5, which places the two smallest values in the wrong order.
Question 23. A tenant with a disability requests a reasonable accommodation to use the rental property. How should the property manager analyze the request during Sydney's Oak Park vacant lot file review? Option A. Deny every accommodation to keep rules identical. Option B. Approve only accommodations requested by owners. Option C. Evaluate whether the request is reasonable and necessary for equal use and enjoyment of the housing. Option D. Treat the request as an automatic eviction notice. The correct answer is option C. Evaluate whether the request is reasonable and necessary for equal use and enjoyment of the housing. Fair housing analysis considers whether an accommodation is reasonable and related to the tenant's disability minus related needs. Blanket denial, owner minus only approval standards, or treating the request as eviction would conflict with the purpose of accommodation rules. Question 24. An owner personally advertises and negotiates the sale of the owner's own small apartment building. Why is this usually treated differently from brokerage for others? Option A. Every owner must hold a broker license before signing a deed. Option B. The owner is automatically sponsored by the buyer's broker. Option C. The owner may collect commissions from other sellers without a license. Option D. Owners may generally sell or lease their own property without acting as licensed brokers for the public. The correct answer is option D. Owners may generally sell or lease their own property without acting as licensed brokers for the public. Real estate license laws typically regulate brokerage services performed for others, especially for compensation. An owner selling the owner's own property is not thereby representing the public as a broker, while licensing would be required to collect commissions or broker transactions for other owners. Question 25. Quinn is comparing loan terms and closing disclosures. Which federal lending framework is commonly tested with residential mortgage transactions? Option A. TRID and related TILA-RESPA disclosure rules. Option B. The statute of descent and distribution. Option C. The rule against perpetuities only. Option D. A zoning variance issued by the City Council. The correct answer is option A. TRID and related TILA-RESPA disclosure rules. Residential mortgage questions often test TILA, RESPA, and integrated TRID disclosures that help borrowers compare costs and terms. The other choices deal with inheritance, property-law doctrines, or land-use approvals rather than consumer mortgage disclosure.